Hi, I'm Chelsea King. I'm the Executive Director of the Oregon Health and Education Collaborative, and we are a statewide nonprofit that has the mission of interrupting intergenerational cycles of trauma and adverse experiences by supporting community-based partnerships that are going to achieve positive outcomes in health and education. I am here today with Gustavo Morales, who is also a board member of the collaborative. And just by way of introducing you, Gustavo, first of all, thank you so much for being here. Gustavo is the Executive Director of EUVALCREE, which is in Ontario, Oregon. And the mission of EUVALCREE is to develop the social capital and leadership capacity of community members. Gustavo serves on several governor-appointed boards, and we're just very thankful to have your time and talent dedicated to the collaborative.
Thank you, Chelsea. It's great to be here.
Yeah, good, thanks. So my first question for you, just, you're a busy man. I know you're a dad and a husband and a business, you run a business and a nonprofit. So what motivates you to serve on the board of the collaborative?
I saw the opportunity to be able to make meaningful impact by working in something that, as you beautifully said, interjects and interrupts existing systems. And in our modern age and in our modern time, we are still overcoming a lot of systemic challenges and working within systems that were created outside of our time that have impacted and impeded our community's opportunities to be able to move forward. And the collaborative I see as an opportunity to be not only a catalyst, but a leader in moving and addressing a lot of these systemic issues in a way that could change the way that our society operates, not just in our time, but our children's.
I know that you've done quite a bit of that work. You've been motivated to do that work there in Ontario. And I'm curious if you could tell me, maybe a little bit about why you chose to do that work with EUVALCREE and what was important to you about bringing so many partners together.
Whether it be a beautiful storm or the stars aligned, however you want to put it, I was having a midlife crisis at the age of 20 when I left medical school, because up to that point, all I wanted to do was be a doctor. And the system itself is what demotivated me from wanting to continue to pursue that as an option. And so I myself in medical school saw the systemic issues that plagued a lot of students. And it's unfortunate because those are the exact students that we need in our society today to be able to help move forward the dial and helping provide accessible services that are culturally responsive and linguistically appropriate. And so the demotivation from school, the opportunity that existed with the organization, like, you know what, I enjoyed doing that. Even though I wasn't getting paid, I enjoyed being involved in that work and started building out the idea with a group of committed community members. Over the next 3 years, I worked as the executive director as a volunteer, no compensation, no pay. And in 2017, the organization was getting to a space and a place where it was finally able to compensate for the position. And so myself, along with a handful of other folks who were committedly involved with the work, were brought on as its first staff. And from 2007 to date, the organization has grown to over more than 30 staff, a operating budget of more than $3.5 million, and we are excited for the work that's to come for the next 5 years. And when I see the collaborative, I see a lot of what I saw when I first started with the organization, which one of the things that really excited me because I lose sleep thinking over it. And it's great to be able to come back to that feeling and remember that we don't know how it's going to end. We don't know where it's going to go, but we know it's going to go somewhere.
Well, and one of the things I was impressed by when I looked at your website, when I was first learning about you and EUVALCREE, was just the number of partners that you brought together. And I'm curious, that had to have taken a lot of intentionality and effort and time. And I'm curious, why was it important to you to bring together so many people?
When it comes to bringing partners, it's not someone you get along to say, hey, I like what you do, you like what I do, let's call ourselves partners. No, it's an intentional relationship. And when the organization was building now, it's what we want to do is we want to create intentional relationships. Because we didn't want to be tokenized on one end, but we also wanted to be able to look at how we could be a contributing partner for our partner to improve their services and their work. And it was finding that space in alignment where by working together, we improved each other's success and we improved each other's ability to be able to move forward initiatives and projects that were unique to each of our partners. And our organization works in the areas of healthcare, immigration, education, housing and built environment, community and economic development. So our portfolio in our focus areas is quite broad. And that means we need a lot of partners in each of those sectors and each of those areas, both on a systems level and on a community level. And finding where our role within that relationship plays with our partners that already existed and those who are developing. Because within our work and in this modern age, there's a lot of efforts that are being done with the intention to help address a lot of the systemic issues. And so by leveraging what exists, leveraging what could be, and leveraging where we want to be, we created those intentional partnerships. With this collaborative, I see that there's a lot of opportunity to be able to build bridges where none existed, because it's allowing folks to get out of their comfort zone. And so as much as we would like to collapse the system and then put a new one in place, we still have to figure out what's going to happen in that lull. And in that lull is oftentimes where the most chaos happens. And the collaborative, I think, is taking a unique strategy in figuring out how do we take the existing system, be creative working within that system to build something that could ultimately replace itself. Yeah, and really it's working in that gray area and getting enough people who are comfortable being uncomfortable to work in that space. And I feel one of the things, whether the collaborative intended or not to be this way, is that saying, if you build it, they will come, I think is what allowed us to create all the systemic issues that we see today. What we're doing is we're providing the opportunity to help build. And so come to help us build for that future.
Yes, I think that is the perfect statement to end on. So thank you so much for giving your time and this morning, but also just to the collaborative and everything you're doing in your own community as well.
Thank you, Chelsea. I'm so honored to be part of this collaborative, and I look forward to what's to come.